Hello, I'm speaking to you today from Sydney, Australia. I'm Simon Paget, a rehabilitation paediatrician and one of the co-authors of a study, Non-Attendance at Outpatient Clinic Appointments by Children with Cerebral Palsy, that has been recently published in Developmental Medicine and Child Neurology. Our study explored the factors associated with non-attendance for children with CP at specialty outpatient clinics at two large children's hospitals. I'd like to acknowledge my co-authors and the Cerebral Palsy Alliance Research Foundation and Royal Australasian College of Physicians who supported this work. Non-attendance at scheduled outpatient appointments is recognised as a major issue across the healthcare system and health conditions. Non-attendance has impacts both for patients and services. For patients, not attending an outpatient appointment means missing an opportunity for better treatment of an existing health condition or earlier detection of a new health condition. In a recent study, it has also been linked to the increased use of unplanned healthcare, such as emergency departments. For health services, non-attendance can increase costs and wait times and decreases a service's effective capacity, meaning reduced access to healthcare for all patients. Missed appointments are particularly important in a health condition like cerebral palsy, where healthcare in childhood is largely provided in outpatient settings and largely with the aims of early detection and treatment of health problems as they arise. In this study, we identified a cohort of children with cerebral palsy born between 2005 and 2017 from the New South Wales Australian Capital Territory Cerebral Palsy Register. We reviewed these children's attendance at specialty outpatient clinics at the two children's hospitals of Sydney Children's Hospitals Network between 2012 and 2019. Our unit of measure was an outpatient day, where a child could potentially attend multiple clinic specialty types and see different health professionals. Our primary outcome was the frequency of scheduled outpatient days that were not attended, and we explored the relationship of clinical, socio-demographic, and process of care measures that we derived from both datasets. We identified 1,395 children in the Cerebral Palsy Register who attended at least one appointment at the children's hospitals during the study timeframe. This represented about 80% of the total birth cohort in the Cerebral Palsy Register. These children had a total of just over 50,000 outpatient days during the study timeframe, which equated to a median of 4.8 outpatient days per year. Of the 50,000 or so outpatient days, 5,773, that is 11.5%, were not attended. And we saw evidence that the odds of non-attendance increased by about 5% each year. This chart shows some of the details of the clinics that made up these 50,000 outpatient days. The bars represent the frequency of outpatient attendances during the period grouped by specialty type. The most common were allied health, with just over 19,000 outpatient clinics, and rehabilitation medicine with just under 15,000, followed by neurology, orthopedics, and medical imaging. The line represents the proportion of the population seen by the specialty during the study period. Just over 80% of the population were seen by rehabilitation medicine services, just under 80% were seen by other allied health services, 55% saw neurology, and 45% or so saw orthopedics and medical imaging. And you can find more information about the children and clinic types in the paper and supplementary materials. We performed a logistic regression using generalized estimating equations and exchangeable correlation structure to build a model of factors influencing non-attendance. We had identified no evidence of substantial multicollinearity, so the model we built included all the available variables. We found no evidence of clinical factors such as GMFCS, motor type, epilepsy, or intellectual disability on non-attendance. The 10 to 14-year age group had a 17% increase in the odds of non-attendance compared with the 0 to 4-year age group. And those from the most socioeconomically disadvantaged backgrounds had a 30% increased odds of non-attendance. We found no evidence of association with other socio-demographic factors, including sex, country of birth, or residential location. When we looked at factors related to care provided, we saw those who had not attended the last appointment having a 30% increased odds of repeat non-attendance, and those who had had an appointment cancelled in the last 6 months had an 8% increased odds of non-attendance. We found no association with recent multidisciplinary team care or care coordination. So in summary, in our study, children from older age groups, those from socioeconomically disadvantaged backgrounds, and those with a recent history of non-attendance or clinic cancellation were more likely to not attend the appointments that were scheduled for them. We believe this may impact their opportunities for timely healthcare interventions and may negatively influence their health outcomes and potentially result in them using other services such as emergency departments that are less suited to their needs. These are priority populations for us to understand the reasons for non-attendance and revise our models of care to encourage and support engagement in health-promoting behaviours. The way that healthcare is currently structured likely creates inequities that influence if and how it is used, and this includes not attending clinic appointments. An important example of this has been the rapid uptake in telehealth during the COVID-19 pandemic, that while very helpful for some, is not always accessible or suitable for all, and this may have left some families with needs that are less met than they were previously. As healthcare professionals, it is helpful for us to understand how barriers discourage individuals from improving health and work towards more personalised care. We hope our study stimulates more discussion in this area and supports an agenda for equitable access to healthcare for children with cerebral palsy. Thank you very much.